6:07 right now. First up this hour, a clinical trial of the so-called liberation treatment for MS patients says it does not improve symptoms, and the University of Buffalo study also suggests in some cases it even made patients worse. Chris Alkenbrack is a Nova Scotian with MS who underwent the treatment a couple of years ago. He says it's changed his life for the better. And Chris joins us on the phone here this evening. Chris, how you doing, sir?
Oh, I'm doing great, Rick.
Glad to hear. Well, tell us about this University of Buffalo study. It looked at 30 MS patients and found that while the treatment is safe and resulted in no serious adverse events, it provides, says the study, sustained improvement. But you're kind of a walking example of why that's wrong, are you not?
Yeah, I think so. Yeah, it'll be 3 years in 2 months. 3
years now, wow.
3 years, yeah. Time goes by fast.
It does.
Well, I mean, I say, you know, Rick, I probably took 10 steps forward, and maybe I've taken 6 or 7 steps back, okay? Because many of my symptoms of MS are coming back. You know, in all honesty, it's probably a procedure that I'll need to have again, but we'll see. Back to the Buffalo study. What I find interesting, first of all, just to correct you, I don't like to correct you on the air, Rick.
No, you go ahead.
It's not 30 patients. It was 19 patients. There were 10 patients untreated, 9 patients treated.
Okay.
Or it could have been the other way around. But anyway, what I find interesting is back in 2009 when Zamboni's study was originally published, okay, we had 65 people treated. And the neurologists were coming in and saying, well, it's not enough. Et cetera, et cetera, et cetera. Here we have a study, and I find it interesting, is they use the word landmark study of liberation treatment, okay? Landmark study with 19 patients treated, and we can draw conclusive conclusions from that. And back in 2009, we had a study of 65 patients who many of them fared very well and are still doing well. I'm in contact with a couple of people from the original Zamboni study in Italy, and they're still doing significantly better years after their treatment.
Well, despite this anecdotal evidence, though, what is the issue that there seems to be an ongoing issue here with the liberation treatment?
I mean, it's very political. I believe that much of it is linked into the pharmaceutical industry has a lot to lose. They've been gaining and profiting from MS patients based on a faulty autoimmune theory since the early 90s when the first interferons came out. And we now have 16-year studies done by Ebers, who was actually the director of the London, Ontario MS clinic and now teaches neurosciences at the University of Oxford in England. And he's no idiot himself. You know, he's a great scientist and, he did a study and he said, well, 16 years of data and the MS drugs don't work. And yet the minute you're diagnosed with MS, Rick, they want you on a drug as fast as possible.
Really?
One has to consider why when the drugs have been proven not to work more than the placebo effect.
And obviously not as much as the liberation treatment seems to do for folks like yourself.
Yeah, for many people. In fact, when I first read this study, I posted a Facebook update, and I said, oh, wow, so the treatment doesn't work. I mean, I have to phone Carol from Kingston Greenwood here in Nova Scotia and tell her to get back into her wheelchair because she's been out of it, and she was in a wheelchair from 1990 on, right through till she had her treatment 2 years and a month ago, or 2 years and a couple months ago.
And now she's up on her feet and walking about.
Well, she's used a walker, but at least she's up and walking.
Well,
she got her license back. She's driving, and she's still driving. I had communications with her recently. She's still driving. You know, another lady I know in Halifax who was in a nursing home for quite some time because of MS. She's out of a nursing home now, and she goes back to the nursing home and volunteers where she used to be a patient.
And she underwent the treatment as well.
She underwent the treatment in Mexico as well. So, yeah, there's a lot of... And anyway, get back to the study. I mean... How could we possibly? Okay, we know that venous abnormalities. The research is going on worldwide. We know that MS patients have numerous venous abnormalities. And a friend of mine from England, Alison, she said, well, you should ask this question. Could such a tiny trial possibly have included patients with the enormous variety of underlying venous conditions being found in people with MS? I would say, in a trial of 19 people, no.
No.
You know, and I did have some other suspicions about this trial, and I actually spoke with someone who participated in this trial about 2 hours ago, Jim Mossman from Ontario. He said that I could use his name on the air. And he did dispel some of the false, you know, preconceived ideas I had about it. Jim just found out this week that he was in the untreated portion of the trial. So though he underwent a sham procedure, a venography, he did not receive the treatment himself.
So how was did his symptoms improve after?
No. He said that, you know, for the first.
It's not a placebo effect, I guess, is what I'm asking here.
No,
yeah.
no, absolutely. And he told me he knew that he was not treated. But, you know, he spoke with a couple of other people from the group who were actually treated, and they thought that they had not been treated. Uh-huh. You know, so there may have not been a lot of clinical improvements in these people, but we're talking 10 people, okay? Worldwide, over 30,000 people have undergone this procedure. And that's what we're hearing in the literature and in the reports, even from neurologists and so forth.
Then can we say about of those 30,000, how many have had dramatic improvements like yourself? Are you able to say that yet?
Well, no, and we would have that data if Canada had kept its promise to have a registry. They've promised a registry of follow-up on people. Dr. Christy Duncan from Liberal MLA has been pushing to have a registry. Now, imagine if they had that data from 3 years of procedures, from thousands of Canadians leaving our country as medical refugees, you know, participating in medical tourism. Imagine if we had kept, you know, that data. We would already have the results of clinical trials.
But perhaps your example, though, kind of also tells us that maybe this is something that has to be done on an ongoing basis, every 2, 3, 4 years, something like that.
Yeah, well, so that's that. Hey, you know what, Rick? I used to take interferons. I've saved you as a taxpayer probably close to $100,000 in 3 years because I don't take my MS meds anymore.
Well, that's something.
I'm not telling people not to take their meds, okay? I don't want to give the wrong, you know, they need to, that's a really personal decision, okay? I don't want to be on the air, you know, Chris Alkenbrack said don't take your meds. That's a really personal decision. There were no more meds for me anyway because I was in the secondary progressive stage of the disease and the chemotherapy treatment didn't work. So, but anyway, that's a whole other story.
But the point of fact is that the liberation treatment gave you, again, a new lease on life. And,
sure.
And now you say that some of your symptoms are coming back and maybe you have to take it again. But so what? So be it.
Well, exactly. And I will. You know, my wife and I are planning a trip to New York City this summer, hopefully this summer, if I can afford it, and I will probably undergo another procedure. I'll have at least my veins looked at. We have people trained in Nova Scotia, but of course, because I'm an MS patient, I can't have that done. Anyway, but at least, you know, there are some positive things, okay, from this study, okay? We know that CCSVI exists. The neurologists in the beginning said, oh, it doesn't even exist, it's not a condition, okay? We know now that it exists. Also, we were told in the media by many prominent neurologists that vein dilation, or what they call the liberation procedure, is dangerous. Well, now we have the confirmation from this study that it's not dangerous.
That it's not dangerous, yes.
You know, we've also had 3 or 4 retrospective studies done and published in peer-reviewed journals in the last couple of years, you know, that it's not dangerous and that the risk is actually very small. It's actually smaller. What I've read is that the risk of venous angioplasty in the vein is actually even less than the risk of an adverse side effect is less than if you have a coronary angioplasty in the arteries. Well, I mean, I'm not a medical professional, so I can't really, you know, talk about that, but that's what I've seen in the literature. And another thing, too.
We've got about less than a minute now.
Okay, one last thing I just wanted to say is it's interesting that they start out with a negative title. MS patients did not benefit from CCSVI landmark pilot study of liberation treatment finds. But then the conclusion that the neurosurgeon, the Siddiqui, who performed the procedure, he said, this is not the last word on the endovascular treatment for MS. And I'm glad he said that, because what all this says, all this means for me is that we need to study it more.
No question.
Anything else. Yeah.
All right, Chris. Well, listen, as always, I appreciate your expertise on these matters, and thank you for talking to us.
Well, sure. Great. Anytime, Rick.
Have a great night.
Yeah,
you too, sir. Bye-bye. Chris Alkenbrack, and he is living in Nova Scotia's Annapolis Valley. He is an MS patient who underwent, as he said, just about 3 years ago now, the so-called liberation treatment. And again, it certainly improved the quality of his life.